My name is Kristen McAdams, and I'm the host of the Psychology podcast and an integrative mental health counselor. And I am here today with Dr. Matt Dawson, who is a brilliant mind in the genetic space and AI precision medicine. He is the CEO of TrueDiagnostics and the CEO and founder of Wild Health. So welcome, Matt.
Thank you, Kristen.
Thank you for joining me. This is going to be such a wonderful talk because you are just so knowledgeable, and he is one of the kindest, most intelligent men I've ever met. So I'm very honored to speak with you today.
Thank you.
So tell me, what is it like to be at the head of precision medicine?
It's really exciting. In my mind, it is where medicine needs to go. It's the future of medicine. And when I say future of medicine, it's here right now. We just need to get the word out to more people that we really can personalize treatments down to the level of DNA.
Amazing. That's so important to me. Like, I find that there's so many barriers, and I find that people don't really fully understand genetics. Like, I think they think they're kind of stuck with a genetic code, and they kind of look at it as like, well, I have this genetic code and it's going to determine my outcomes. And that's not really the case though, is it?
Right. Yeah. So technically you are stuck with your genetic code, but there's a lot you can do about it. So that genetic code that you have, that's hardwired, that's your human operating system, but it only accounts for about 20% of your health outcome. The other 80% is how you express those genes. So everything you do, what you eat, how you sleep, what you're exposed to, how much exercise you get, all of those things are turning your genes up and down. So you have these certain genes that give you advantages, some that give you disadvantages. And so being able to modulate those and affect those, that's how we get the other 80% of our health outcomes. So there's a lot that we can do. We really are in control.
It's interesting because it's like that nature-nurture debate has been going on for a really long time. And it almost sounds like they're a little bit like one and the same thing.
Yeah.
Is that true?
Yeah, it's both. Yeah. I mean, we just talked about the nature part. That's the genetics. That's like 20%. The nurture part is the bigger part as well. And so it is both. Like, certainly the genes you're born with have an effect on your health, but not as much as what you do.
Interesting. Okay. So what brought you into the genetics research and industry?
Yeah. So I was in traditional medicine. I was just treating patients in a university setting. And I just saw that it wasn't working. People weren't really getting better with traditional medicine. And at the time, my job was to kind of identify emerging trends and emerging science, and then try to teach other medical students and other physicians about it. And I started seeing all this science around genetics. And it looked like, oh wow, we really can personalize everything, not just which medications will work, but also what foods people should eat and shouldn't. And it's different for everyone. Mm-hmm. How they should exercise, it's not the same for everybody. How to optimize sleep, it's different as well. What supplements will work. All of these things, we had all this science, but the issue is medicine is usually 15 to 20 years behind. So no one was doing it.
Yeah.
So that's just seeing that gap between what we could do and what we were doing is what really pushed me to get into the space.
That's amazing. What a jump, what a leap, right? Like, to just jump into the future like that, it's amazing. We need people like you to overcome those barriers. So we have a biological age test here that we're going to take live. So I like the whole experience, education, engagement. And this is one test that you can start with. So can you tell us a little bit about this test?
Sure. So we just talked about genetics and epigenetics, although I didn't use the word. So genetics is the DNA you have. The epigenetics is how you express that DNA. So that's what this test is looking at. It's not a genetic test, it's an epigenetic test. Mm-hmm. So it looks at about 1 million different gene sites, how much every one is turned up and turned down.
Interesting.
So we're actually measuring those epigenetics. When we think about precision medicine in general, I'll give you an example. When we first started doing this precision medicine, we treated my mother. My mother, she had a specific gene that made her more likely to get Alzheimer's and dementia, which she got from her mother, my grandmother, who passed away from that disease. So she had that gene, but we wanted to do something about it through epigenetics. So we designed a perfect food program for her, the perfect exercise program for her, sleep and supplements. And she lost 40 pounds, reversed her insulin resistance, and said that she felt 20 years younger. So that works, being able to change how we express our genes. We've done that with thousands of patients now, had similar results. When she said, I feel 20 years younger, at the time I was like, it'd be great if there was a way to actually measure that. And there wasn't at the time. There were biological age tests, but they weren't very good. Now there's some really good with the second and third generation clocks. So Harvard developed a clock called the Omic MH clock, which is really good at telling you how many more years you have to live with your health span. Yale developed one called the Symphony Age, which tells you your organ system ages, because your organs age in a heterogeneous way. Your brain, heart, lungs, kidney may age at different rates. And then Duke developed one called the PACE test, which tells you your rate of aging, which is my favorite, because it's been shown to be very, very sensitive to change. So if you get pregnant, that's a physiologic stress, your rate of aging goes up about 20%. When you deliver the baby, it comes back down. Same thing if you get COVID, you get in a car accident, have hip surgery, your rate of aging goes up, comes back down when you recover. So what this rate of aging test allows us to do is optimize things, do N-of-1 experiments for you. So if you said you want to do a carnivore diet or a vegan diet or a Mediterranean diet, we could look at your pace of aging before and after a few months on the diet, and see how it affects your rate of aging, if it's good for you or bad for you. Stanford just did this study with twins where they compared omnivore versus vegan diets, and they would switch them back and forth on these diets, and they found that in 8 weeks, this pace of aging test changed. So you can optimize things like diet, or see if something like rapamycin or a certain molecule is going to benefit you in your rate of aging by doing this test. All 3 of those tests, the one from Harvard, Yale, and Duke, you're going to get results with this. You're also going to get a lot more than that. So when you look at 1 million genes and how they're expressed, you can tell so much more information. Because if you have a certain disease, for example, like a certain cancer, it changes your gene expression. And we can find the fingerprint for that. So we can find the epigenetic fingerprint for a pancreatic cancer or something like that and be able to diagnose it. There's companies like Grail that does that. The Cologuard test from Exact Science does that as well. It's gene expression. Yeah. And so we can also we can predict and tell biomarkers like CRP, your level of inflammation, hemoglobin A1C, your metabolic health. So with this test, you're going to get the 3 aging tests. We have another test called the True Health. So the True Age test gives you the 3 aging, answers those questions about your biologic age, your pace of aging, and organ systems. And there's another test called the True Health. Both of those are done with just a few drops of blood. And that True Health test is going to give you about 180 biomarkers to tell you an incredible amount of information about your health. Are you deficient in certain vitamins or minerals? Do you have inflammation? Do you have metabolic issues? Do you have certain toxin exposures like glyphosate or other toxins? Some hormone questions as well. So you're going to get a lot of information just from a few drops of blood. All of that I talked about, you'll get from that.
I can't imagine having this level of data, and it really is probably the highest resolution bioindividual set of data you can get for yourself, right? Because everybody's out there trying to fit themselves into these consistent routines that are overgeneralized. And like you said, the vegan versus the carnivore diet, maybe it really is different for different people, and really figuring out what is your unique way of metabolizing things or dealing with stress or inflammation.
That was a big aha moment for us when we first started doing precision medicine. My co-founder and I, when we looked at our genetics, it looked like we needed to be on the exact opposite diet. He had all of these sensitivities to saturated fats and certain things that I didn't have. And I had all these sensitivities to certain carbohydrates and types of carbohydrates. It looked like I probably needed to be on more of a ketogenic diet, kind of an animal-heavy diet, a lot of protein, animal fats would be fine. For him, it looked like he needed to be on almost a vegan diet. So we did a little experiment with that where for a certain period of weeks, we would eat the exact same diet. So first, we would eat his diet, kind of a vegan diet, do the same workouts, draw our blood before and after. He would destroy me in the workouts. His blood looked better. He felt great on his diet. Then we would switch in the same workout. I would start being him. I felt much better. My blood improved. And we're like, wow, this is crazy. And we understood why people, have these religious war type conversations about food. The vegans, they found this works for me, so this works for everybody. I'm going to be an evangelist.
That's always the assumption.
Yeah. And we're all just so different. You have to do the testing, the genetic and the epigenetic testing to really get that data. A lot of people will figure it out over time, just through trial and error.
Yeah.
But we like to.
It takes a long time.
Takes a long time.
Yeah.
A lot of trial and a lot of error.
Yeah.
So we want to decrease that time and actually go straight to the source and say, this is what's going to work for you. Let's do this instead of doing all the suffering in the meantime.
Yeah, and just save yourself the time and worry and trouble.
That's right.
And you guys were playing with that in real time, really embodying your metabolic output, just testing that on yourself. That's really cool.
Yeah, when we do the workouts, it's fun. We're measuring a lot of things. It's not just how we perform, but our heart rate, the reps we do. We're measuring glucose and ketones and things like that, and then to see how we metabolize things. It was so interesting how when I eat a lot of fats, everything's great. And when he eats a lot of fats, you get an inflammatory response from it and things. And so Everyone's just different.
Wow.
So let me show you how easy this is.
Okay,
So
you're going to do a finger prick?
Yep. I'm just going to take I'm going to take this area, I'm going to clean it off.
You know what's funny is that I used to have a fear of needles, and I find that a lot of people do, but it's actually the wellness industry that got me over that fear.
That's funny. Just because you were doing it a lot, or?
I think it was because I knew I was doing it for my health and not necessarily for, I can feel that.
That's it. So now I'm just gonna milk a few drops of blood, milk out onto the card. Yeah, it's a weird way of saying it. Just squeezing it out. Yeah.
You're seeing this real time, y'all. Real time.
And all we do, this is called a dried blood spot card.
Okay.
And we just need a few drops of blood to saturate through it. And then this is just sent to the lab, and we're able to take the blood from the card and look at the epigenetics. Look at how much all of your genes are being expressed right now.
Amazing.
And this really is the future of medicine, the epigenetics. Like what you can predict with these epigenetics. And I've told you about the biologic age.
Mm-hmm.
Told you about all the 180 biomarkers. You have companies like Grail and Exact Science, like talked about the Cologuard, who are diagnosing cancer through epigenetics. What you can predict with this is really limited by your imagination and the size of the data set. That's it. Like we can, like just as an example, you talking to me right now, if you're enjoying our conversation, you're expressing your genes differently than if you were annoyed by it or you didn't believe me. So
it's that fine-tuned, huh?
Exactly. So if we had like a group of people who's listening to me and I give a really annoying talk and we drew their blood with their epigenetics, and then I gave a really brilliant talk that was hilarious and engaging and drew their blood, like there's different epigenetic patterns for each of those.
Wow.
So any disease, when you have a certain disease, you're going to be expressing genes differently. So we can find the fingerprint for that. And in fact, we just completed a study with Harvard. They have a 100,000 patient biobank where we're looking at that too. Can we predict disease, these chronic diseases that are killing us? And we haven't published it yet, so I can't like give you the punchline. But I'll tell you, like the day I saw the results, I'll remember it. Like you remember big events in your life. It's amazing. It's still going to be the future of medicine for sure.
So briefly, what is the difference between biological age, chronological age? Are there what are the differences between those things?
Great question, and I'll show you. Like, it was that easy. What we did, we put this little card in here. And we stick it in an envelope.
Oh, and just mail it out.
Yep, and then you're going to get those results in a few weeks.
What happens to the data also? Not to ask multiple questions at once, but I'm very excited about this.
So you get all the results. The data itself, it doesn't go anywhere. We don't sell that data or anything else. It's
good to know. I think people get worried about that type of thing. I think they want to trust in the company that they're providing their samples to.
Yeah, exactly. Yeah. I mean, we have certain requirements with HIPAA and things like that. It's just different. We're a CLIA lab, TrueDiagnostic. It's different than like you think about a 23andMe or other consumer company. They have less regulations. They don't have to abide by all the HIPAA stuff and things.
Right.
So so we have very strict requirements on the data.
Difference if you're like a legitimate medical provider versus a generic corporation.
Yep, okay. That's right. Yeah. So you ask about chronological age versus biologic age.
Yeah.
So chronological age is pretty easy. That's how many birthdays you've had, right? And most people know how old they are. If they forget, you can look at your license and there you go, do some math.
Sometimes they choose to forget.
Exactly. Yeah. But and if you choose to forget, that's fine because it doesn't really matter. Chronological age doesn't really matter and affect your health. Biologic age does. So we all know people who are 80 and look and perform like a 60-year-old. People are 40 that look and perform like a 60-year-old. And so that biologic age is by far the number one risk factor for everything, for mortality and for every chronic disease.
Okay.
So if you look at your risk of dying from cardiovascular disease, which is the number one killer of Americans, you look at how much smoking increases, which is a lot, how much obesity, how much hypertension influences it, and you add up the risk of all those, it doesn't compare to just the single risk of biologic age. Mm-hmm. It dwarfs all of those.
So like the number of years is not relevant in relationship to the function of your cells in your body.
Yeah, exactly. Yeah. And as we age, like chronologically, we're also biologically aging, but if we can slow that down, there starts to be a wider and wider gap between the two, and that's what you want to do. That's why I love the Dunning-Pace test, the PACE test from Duke, I mentioned, which you're going to get the results of. If that is a 1.0, you're aging biologically 1 year. For every year, you're aging chronologically. If you decrease that to 0.9, you're aging at 10% the rate. I've got mine down to 20% of the rate.
Okay.
I've had patients who take it down to like 0.67. So what that means is they're only aging at 2/3 of normal rate. So over the next 30 years, they'll only age 20 years.
Wow.
So that means they're adding 10 years to their health span when you do that. So that's why I like that PACE test, because you can continue to do things and experiment and try to push that lower and lower with lifestyle interventions, caloric restriction, different diets, different exercise programs, optimizing your sleep and stress. And you can see how all of those things have an effect on your pace of aging.
It really takes the guesswork out of things.
It does, yeah. I mean, wild health, when we see patients, we can see with their DNA and all this blood work, and then we make precision recommendations. So precision instead of just guessing. But then you want to have a measurement stick forward, which would be the PACE test.
Okay.
Yeah. So we try to take the guesswork out of it by looking at the genetics and what would probably work for you. But then by measuring the PACE test as well, we get to see if we're right. Because I always tell people it's precision medicine, it's not perfect medicine. Like we get a much better hypothesis around what's going to work. Instead of just saying, hey, this works for most people, 60% of people, that from the study says this works, that means it works for 60% of people. So we're going to try it for you. Instead of saying that, we look at your genetics and we say, okay, it looks based on your genetics, I think this is going to work. We have more like a 90, 95% confidence. So we're improving our bets as to what would work, but then we want to have an objective marker and test it too.
Interesting. Improving the bets, I like that. People might get on board with that if they feel like they can gamble with their health. That's almost more acceptable to people, I feel like. So tell me, how does AI play a role in what you're doing?
Sure. Yeah. So in many ways. So most of what we do would just not have been possible 5 years ago, both on the wild health side, the precision medicine side. What I mean by that is we collect millions of data points. So 700,000 genes when you look at your DNA, a ton of blood work, wearable data from all your devices, phenotypic data from questionnaires, and then to make decisions off that and give you guidance. The human brain is just not meant to take in millions of variables at a time.
Right.
No matter how smart your physician or someone is, it just isn't.
It's designed to filter it out, right? It's designed to filter out things that you don't need to think about or remember.
That's right. And most of that information isn't super important, but that's what the AI and the machine learning is for, is to make all the connections and then say, what is the perfect food for you? Like my mother had a EDR SNP, which means she needed more vitamin D, BCMO needed more vitamin A, FAS2, more omega-3, collagen 5.1a, and she needed more collagen protein. So all of those, plus these other factors that we saw, like her insulin resistance or other lab work, meant that the machine spit out that, sardines are the world's perfect food for you. And maybe she hates that.
She hates that.
What are the next 5? What are the other superfoods for you?
Yeah.
What are kryptonite foods for you? So she had SH2B3, so wheat and gluten, an MCM6 gene, so dairy. So it finds all of these things and say, here's the perfect foods, here's your kryptonite foods. And we don't talk so much in terms of like keto, vegan, like these classifications, because we can get more granular than that to actual foods. But that's what the AI does, is be able to find all that and make the recommendations. The AI also is necessary for what I just talked to you about from the epigenetics. Like when we look at 1 million genes on the epigenetic side, how much each one are being expressed, we really need the machines and machine learning for that big data to be able to then predict those 180 biomarkers that I mentioned.
Yeah, to big numbers.
Pace of aging.
Yeah.
So it's just completely necessary for both of these things. The next step, though, is not just AI and machine learning. So that's kind of around big data. The next step, and I think where the real future is going to, is large language models. So the newest form of AI. So we sequence everything with machine learning and the big data, but then we deliver the care. Traditionally, it's been done by a doctor and a health coach. These large language models like ChatGPT, if you were to ask it, give me a 7-day meal plan, or what should I eat today, it'll give you an answer. It's not personalized.
Yeah.
So we took all of that IP that we built, the AI, and we built it on top of a large language model, so that then you can ask it, like I can ask it, what should I have for lunch today? And it'll give me a specific dish close to where I am, based on the fact that it knew how I slept, it knows my DNA, it knows my blood work, it knows my epigenetics, it knows what how I worked out this morning. I lifted for about an hour, and it knows what I had for breakfast this morning because I just log it in there. So the perfect meal for me right now.
And it'll tell you where to go get it.
Exactly. Yeah.
I need that in my life.
and then it can say, yeah, I'm not in the mood for that. Give me the next 3, and it'll do. You can interact with it. Like you can chat with it, and it'll give me alerts. Like recently, it gave me alerts that I was overtraining, and I was probably going to get sick or injured. And so then I interacted with it. I said, well, how do you know? What do you mean? And it showed me my HRV trends, my resting heart rate trends overnight, my sleep, how much I had been working out still. And I was like, oh yeah, I've been traveling, not sleeping as much, still working out just as much. And so then I asked it to give me a 7-day workout plan to recover. And it gave me one based on my DNA, all the information it had for me, and knowing my goals. Like I'm getting ready to climb a mountain called Cotopaxi in about 10 days. And I'm trying to improve my pickleball game. So those are like 2 main goals.
Yeah, 2 goals.
Yeah.
Love that. That's got to be even more important for women, because I work with women a lot and I teach them how to make lifestyle choices based off their hormone cycles. Mm-hmm. And a lot of times what I find is that they are stuck in these produce, perfect, perform sort of processes, and they overdo it, and then they reach burnout. And that's like a big thing for women. It's a big thing for mental health therapists. Like they don't know how to best support themselves and best support their bodies. Yeah. So that's really important for just not only individual well-being, but I feel like practitioners' well-being too, that are disseminating this information from brilliant minds like yours to the general public to make it more accessible. And the AI piece, people, I feel like it aggregates that information from all over the internet, so it's pulling in all kinds of sources. But yours is specific to your bioindividual. You as a bioindividual, and it's like that's protected in that way. So it's not pulling all this random information, right? Just to be clear, so people know.
And it has both. It has all the world's information, so it can pull from like what restaurants are close by and what's on the menu. But then for the actual recommendation, it's pulling from all the data that I have, and what is the newest evidence around this data, because that's changing as well. So it's just it's completely up to you. And I love what you said. It's important about women. So when I go back to the overtraining thing for me, like historically, I've just been very hard-headed and I just like push through until I break. And having this objective feedback helped me not to. But I think it's the same thing with women and their cycles, and whether they're perimenopausal or menopausal or not, that they feel and perform differently different times of the month. And having objective feedback on that, I think is really important. Because otherwise, there's so much pressure to perform regardless of what's going on with your hormonal status or cyclically, that women don't give themselves the permission, or they think they start judging themselves because, okay, I'm not right now where I was 2 days ago or will be, but I'm expected to do the same thing. To have this objective feedback that says, no, like you need to eat differently right now, you need to work out differently right now, you need to sleep differently right now, the stress you take on should be different right now. Yeah. It's just really good to have that objective.
It gives you permission.
Exactly. Yeah. You could be easier on yourself. You could be more compassionate towards yourself. Not judge yourself.
Yeah, there's just all these like sort of negative social constructs. Like one of my jobs is to break down social constructs so that I can remove that barrier between individuals and their well-being. And that construct of like, I'll sleep when I die, and everything, consistency is key, and like you just see it everywhere, and people absorb that from social media and the television and everything else. So I think it's a huge barrier to overcome, because if you take a step back and you start listening to your body, or you start listening to the data and start making those lifestyle changes, people tend to get that blowback. So it's really important. I think what you're doing is amazing, because you're breaking down that barrier between those individuals and their well-being, and it's just so important.
Yeah.
So do you come up against any resistance at all to some of the work that you do, or?
I do a similar thing about that. I hear people say, I'll sleep when I die too, and it drives me crazy. I say, no, you'll die when you die, and it's going to be a lot sooner if you don't get good sleep. So you got to sleep. That drives me crazy.
Yeah.
Resistance to what we do. Not when I talk to someone about it and they understand. If people just hear genetics and epigenetics and AI, like people are scared of what they don't understand. Mm-hmm. So sure, if people just heard those things, hear about AI and genetics, like they think that we're doing like genetic engineering or doing all these other things, so they can certainly be scared of it. But no, once you tell people what you're doing, like you're just trying to unlock the secrets of genetics and epigenetics to help you, like perform your best, do your best, and live as long as you can, as healthy as you can, so you can be around your loved ones and do the things you love. That's the point of all this.
Yeah.
It's not about the technology or about these cool things. It's about helping people do what they love and be with the people they love as long as possible.
Amazing. So one of the things that you told me that the future, our conversation of the future, might be actually even pairing like therapists like me from different modalities with people too. Like you can find that information in the genetic code as well, in terms of like somebody who is looking for a particular type of therapy or therapist or even type of medication, right? I come up against that a lot in my practice with people wanting to come off antidepressants or going through rounds and rounds and rounds of like trying things and trial and error. So that I find to be really interesting, because one of my passions is getting the medical wellness and mental health industries to all communicate so that we can have a higher resolution understanding of what people's bioindividual needs are. So you're really breaking down that barrier and making that connection strong for people.
Yeah, I mean, at the root of what we do with Genetics and Epigenetics is we're trying to get this data to predict the future for you so we can have an impact on it. So just like my mother, I talked about the gene for dementia. We found that, and now we have an impact on it and preventing that. So we think about therapy, and my wife's a psychiatrist, and so when we talk about medications or therapy or different things, it's for a long time we've known there are very specific genetic tests to see, are you going to respond favorably or unfavorably to SSRIs, certain SSRIs, which one's going to work best for you or not. So we've been doing that a long time. But there's really cool stuff coming out on, you mentioned like therapy. So for example, if you have an OXTR, specific variant of that gene, it's related to oxytocin, and those people tend to actually respond much better to loving kindness meditation than other people would. And so loving kindness meditation, but Tara Brach developed that, I'm sure you're very familiar with. Great for just about everybody, but people with those genes especially, when we see that, it's like, hey, you really should do this. So as I mentioned earlier with epigenetics, like we can predict, like you're only limited by the size of the data set and your imagination. There's so much to unlock there. I think that's just the beginning, like being able to pair like something like that, loving kindness meditation for certain people, or CBT may be better for certain people with certain genetics too. We're not as deep there yet, but it's there. We can see it. And so I'm really excited about that potential too, to do precision therapy, I guess is what it
Precision therapy. Yeah, amazing.
Yeah, I never heard that term. We just coined it.
We just coined it. You heard it. You heard it here. We just coined that term. You guys can't have it now. It's ours. So just to wrap up our conversation, where do you see the future of this going? Like, where do you see, where can we implement this? Like, I feel like academia, like I want to improve the path to professionalism for practitioners. So just in academia and training and like bringing this information into places where people can access them and learn about it. And like, how do we improve access in the future so that everybody can have something like this?
Yeah. It takes a while to get into kind of academics and stuff. Like in my prior world before I did precision medicine, there's a new technology that was really powerful. And I was part of bringing that kind of to mainstream medicine. And it took a good decade or more after the science was really there. So I think on the one hand, we have to be patient. It's going to take a while. Medicine is skeptical for a good reason. Like we want to see if something really plays out. I'm seeing it happen already. I'm seeing in medical school and in residency, people start talking a lot more about precision medicine and genetics and epigenetics. So it's happening. I think the main thing that we can do when I think about myself, it's a couple things. It's just educating the public, because the more consumers understand it's there, the more they push for it and demand it. And the other thing is just publishing. Like we're at TrueDiagnostic, we published like 32 studies in the last 2 years with Harvard, Duke, Mayo Clinic, Johns Hopkins, all these like leading institutions. We're trying to publish and get this out too, because we really do need to. We're at a Biohackers conference right now, and one of the things is like we really need to not be making claims and things without some evidence behind it. So people who are pushing the envelope, that's great, but we need to be doing the research in a responsible way also and publishing it so that academia and mainstream will come on board and
Incredible. You're really paving the way forward for the future. I have so much respect for you, and I'm so excited that I got to have this conversation with you. And so I really appreciate that you took the time, and appreciate your time and energy, and thank you for having us.
Kristen. Yeah, we're going to have to, as soon as we finish this, go trademark that precision therapy too.
Yeah, we're definitely going to have to do that, absolutely. And I cannot wait to see the results for this test. Thank you so much.
All right, thank you.
Unlock your full potential at the Biohackers World Conference and Expo in Los Angeles on March 29th and 30th. Connect with leaders in health optimization, learn the secrets to longevity, boost your performance, and dive into the latest biohacking and wellness innovations. Don't miss out. Tickets are going fast.